vaping is not going to be good. I mean, it carries loads of other harmful substances. But if we compare perhaps 2 or 3 pack a day smoker, and they replace it with a small disposable vape every 2 or 3 days, I'm guessing that's better than smoking. But we cannot advocate that vaping is good, because vaping is not good, and it's not so much perhaps the amount of nicotine, but it's all the other chemicals that are in it, which exacerbate asthma. You've got a higher chance of getting COPD, emphysema, and a lot of complications. So I would try not. I never recommend anyone to go and use vape. To be honest with you, I think that's causing a big impact also in the younger generation.
Do you see young people going to the Cessation Clinic, or is it
I'm
generally
seeing an
adults?
influx in young people. Yeah,
When you say young people, like more or less what age?
I think the youngest I've seen is a 14-year-old, 13, 14-year-old. And again, a very difficult situation to manage. Um, I'm seeing a lot more 17, 18-year-olds coming in wanting to stop vaping, which is, I think it's a fantastic thing.
Very positive that they're reaching out.
It's a positive thing that they're reaching out, and unfortunately, and this is now addiction, right? Sometimes you have to hit a bit of rock bottom or feel some consequences physically to get scared enough to come and seek help. If we compare smoking back when I was in school, very rarely would you see anybody who would smoke 2 or 3 packs a day. They might get a sneaky cigarette here and there at 14, 15, 16, those that go down that road. But nowadays, if we compare the amount of nicotine that the kids are taking, it's equivalent to about 2 pack a day nicotine. So you can imagine, in we go to the brain, when we talk about addiction, it's really messing up the pleasure center, the reward system,
Especially
or
at
the
that
dopamine.
age when their brains are still developing.
Exactly, and that is the most worrying part, that they're damaging those. We can call them little cables, the receptors and neurotransmitters. They're damaging them at a very young age, and then that damage can go across to adulthood, and they've got a higher chance of experimenting with other addictive substances.